Hello and welcome to medicinal chemistry classes. Today we will discuss about sulfonyl ureas. Sulfonyl urea are a class of organic compound used in medicine and agriculture. It is widely used as an anti-diabetic drug in the management of diabetes mellitus type 2. They act by increasing insulin release from the beta cell in the pancreas. This is some example of sulfonyl urea. So first drug of sulfonyl urea category is your tolbutamide. Tolbutamide. So this is the structure of tolbutamide and this is IUPAC name of tolbutamide. So what is property of tolbutamide? It is a white or practically white odorless crystalline powder. It is insoluble in water and soluble in alcohol and chloroform. The preparation of tolbutamide is tolbutamide injection and tolbutamide tablet. The mode of action of tolbutamide is the tolbutamide cause depolarization and the opening of voltage gated calcium chloride channel, and they increase intracellular concentration of calcium ultimately and stimulate preform insulin secretion. So this is the mode of action of tolbutamide. Next is clinical uses. It is given orally in the treatment of type 2 diabetes mellitus and has duration of action about 10 hours. It is sometime has been used in the diagnosis of insulinoma as well as other pancreatic disorder including diabetes mellitus. Next drug of sulfonyl urea category is your chloropromide. Chloropromide. So this is the structure of your chloropromide. It is a first generation insulinotropic agents which stimulate release of insulin from the pancreatic P cell. It should be avoided in elderly and in a renal or hepatic impairment because of hypoglycemia after the taking regulatory at a long period. Next, the property of white crystalline powder having a solid odor. It is soluble in alcohol and chloroform and insoluble in water. Next, the mode of action of chloropromide is the first generation insulin atropic agent. Act by closing membrane bounded ATP sensitive potassium channel on the P cell, which stimulate release of insulin from the pancreatic cell. So this is the mode of action of your chloropromide. Next, the clinical uses. The chloropromide is a sulfonyl urea anti-diabetic agent used in the treatment of type 2 diabetes mellitus. It has the duration of action at least 24 hours. Next drug is your glipizide. So this is the structure of your glipizide. The property of glipizide, a white or almost white crystalline powder. It is practically insoluble in water and alcohol and very slightly soluble in acetone and in dichloromethane. It's stored in airtight container and protect from the light. So this is the property of glipizide, sorry. Next, the mode of action of glipizide. It's inhibit this potassium ion channel. So if flicks of potassium ion block and lowering the membrane potential to cause depolarization. The voltage depend calcium channel then open, increasing intracellular calcium concentration. The increased intracellular concentration of calcium stimulated preform insulin secretion. So this is the mode of action of glipizide. Next, the clinical uses of glipizide. It is a sulfonyl ureas antidiabetic is given orally in the treatment of type 2 diabetes mellitus and the duration of action up to the 24 hours. It is given with initial dose of 2.5 to 5 milligram daily, given as an single dose about 30 minutes before the breakfast. Next drug is your glimepiride. Okay, so this is the structure of your glimepiride. Property: it is a white powder. It is practically insoluble in water and sparingly soluble in dichloromethane and soluble in dimethylformamide. This is your DMF, and it is dissolved in dilute alkali hydroxide and in dilute acid. Next, the mode of action. The glimepiride stimulates the release of insulin from the pancreatic beta cell, and it enhances the beta cell sensitivity to glucose. The glimepiride inhibits the potassium ion channel. It inhibits secretion influx which cause depolarization. So voltage dependent calcium channel open, which on increasing the intracellular calcium concentration and stimulate preform insulin secretion. So this is the mode of action of glimepiride. Next is clinical uses of glimepiride. It is a sulfonyl urea agent given orally for the treatment of type 2 diabetes mellitus. The additional dose of 1 to 2 milligram daily may be increased if the necessary to 4 milligram daily for the maintenance. Next clinical uses: it is very effective sulfonyl urea antidiabetic agent. It has rapid onset of action. So this is the clinical uses of your glimepirides. Okay, so this is all about your sulfonyl urea and sulfonyl urea drugs. Thank you.